That's what I just chatted about.
That's right. Thank you very much for the reminder. Thank you everyone for joining us today. This is our third webinar in our 2021-2022 webinar series. Today, our neuropsychologist, Dr. Natashia Brown, she's going to be talking to us about concussions, what they are, what to do about them, when to worry about them. We're going to learn all kinds of really great information. I am Mandy White-Ajmani. I am the owner of Small Brooklyn Psychology. We are a group psychology practice at Industry City in Brooklyn, New York, where we offer therapy and neuropsychological assessment to people of all ages, all backgrounds, all psychological concerns. You can see all of our clinicians at the bottom there. We've recently grown this year and it's been wonderful. I truly think that I'm very lucky to work with a really great group of clinicians. So that's me first, and there's Natashia there, our therapist, Jill DePietro, Dr. Sam Janit, Dr. Deidre Edwards, neuropsychologist, Nav Gill, psychologist Ben Janitis, social worker Maddie Lawler, and neuropsychologist Danielle DeFilippo. And we all have lots of experience working with people across the lifespan. We have some overlapping and non-overlapping skills, so it's been really great to work in this very diverse field of clinicians. We have special training and experience to do assessment and treatment with children and parents, even down to babies and toddlers. We can do assessment and treatment of typical developmental issues and then behavior concerns. So as I said, this is our third webinar in this year's monthly series. Recordings for our previous talks from previously in this year, but then also last year and some other webinars that we've given, they are all stored on our website at smallbrooklyn.com/services/talks. It's pretty easy to find if you go to the website. This series is media sponsored by Park Slope Parents, our amazing local community resource, local and global, really. I think they have quite a reach at this point. If you are a parent in Brooklyn and you are not on Park Slope Parents, I highly recommend it. It's been such a tremendous resource for me and my family and so many people that I know, as well as professionally. Tons of advice, excuse me, tons of supports, tons of reviews for various resources, and as well as just general life circumstances. I also wanted to put a plug in for staying tuned for our next webinar, which is going to be bright and early in the new year, January 12th. It's going to be me, in fact. I am going to be, sorry about that. I am going to be talking about how to explain diagnoses to kids. It's a difficult thing to do. Well, more that parents are worried that it will be a difficult thing to do. Sometimes it's a lot easier than you expect. Sometimes it's not, but I can talk through all of those ins and outs and what's the best way to do that. All right, during this talk, if you have any questions, type them to me in the Q&A box. I'm going to be monitoring the questions as Natashia talks, and then we'll get to a Q&A session at the end, and I will be asking her some of your questions. So definitely send them along. So now, just to introduce Natashia, she is a clinical neuropsychologist and a certified addiction specialist. She has multiple years of experience in conducting neuropsychological, psychological, and educational evaluations, ranging the lifespan from young children to older adults. She completed her undergraduate degree at Cornell University, with me in fact, her PhD at the University at Albany, and her postdoctoral clinical neuropsychology training at Fielding Graduate University under Dr. Elkanan Goldberg. She has worked in a variety of settings, including medical centers, both inpatient and outpatient, university counseling centers, community mental health facilities, New York City schools, private children's camps, and private practice like ours. Prior to her work with us at Small Brooklyn Psychology, Dr. Brown was a senior psychologist for over 6 years at NYU Langone Orthopedic Hospital within the Rusk Institute of Rehabilitation Medicine. As part of an interdisciplinary team, she worked extensively with individuals diagnosed with traumatic and non-traumatic brain injury, concussion, and injury-related mood symptomatology. So Natashia is going to tell us about all of that, as well as how it all fits together. And I'm going to turn it over to her. I'm going to turn off my video and my microphone so she'll have the show. Thanks.
Thank you so much, Mandy. I really appreciate it. I actually am really excited to talk about concussions today. At NYU, I actually worked in their concussion center clinic and have a lot of experience working within the area of concussions. So today we're going to discuss concussions and what to do about them. Okay. So the objectives for the hour are really to understand concussions as well as we can, what they are, the causes, symptoms in everyday life, when to seek medical treatment, prevention tips, diagnosis, as well as evidence-based treatment. So I think it's really important for us to start off with what a concussion is not. It's not due to an internal or non-traumatic cause. An internal cause would be like a stroke, where someone has a blood clot in their brain. It's not due to cardiac arrest, where there's limited blood flow to the brain because of how the heart is pumping. It's not due to an aneurysm or oxygen deprivation that occurs if, let's say, you're swimming and you know, lose consciousness because there's too much water ingestion. It's not due to a tumor or a brain infection. But it is a traumatic brain injury. And it's important to first step out and say what traumatic brain injuries are. There are external causes, and they're technically, you know, mostly 4 types of traumatic brain injuries: concussions, which we'll be discussing today, as well as contusions, which are basically bruising within the brain, and those contusions can actually be determined through a CT scan, where they can see the collection of blood in any location within the brain. Another traumatic brain injury is a penetrating injury, where the skull, which is a really hard matter, is pierced, and the outer membranes of the brain, your brain is kind of in this nice soft liquid cushion, and then that part of the brain is also covered by a membrane. So it's not a penetrating injury where the skull and the outer membranes are impacted or damaged, and it's not an anoxic brain injury where someone loses blood flow for any number of reasons, and therefore the brain is not getting blood, and therefore no oxygen or nutrients, and therefore brain cells die off. But so as a traumatic brain injury, a concussion is not merely just a bump on the head. It's considered a brain injury. It's considered due to traumatic causes. It's closed and non-penetrating, so the skull is not damaged, the brain is not exposed. It's a mild form of a traumatic brain injury. So that's really important to note, because if it's more moderate or severe, it wouldn't be considered a concussion. And it's not really diagnosed based on a CT scan, because when someone has a concussion, you're not expecting to see a bruise on the brain, you're not expecting to see bleeding, and you're not always going to have a fracture associated with it. So a concussion as a traumatic brain injury is basically diagnosed as the result of someone's clinical symptoms, change in their thinking process, their physical experiences, and those are some of the things that we'll get into. So what causes a concussion? There's only 2 causes: hitting your head, and that can come from any number of ways, or your head forcefully and quickly moving back and forth without hitting something. So for the first part is pretty easy to imagine, but the second part, think about if you were in an accident, or, growing up, we'd see those videos or commercials on TV of someone having a car accident where their head is dramatically and quickly thrust forward and then back. If someone's not hitting a hard surface, there's no expected reason for them to have a concussion, but that sudden thrust forward and backwards can actually lead to the brain hitting on the skull, or shearing and tearing of brain tissue. So that's why a head forcefully moving back or forth can cause a concussion. And that can also not just happen in a car accident or really sudden fall that's really dramatic from a certain distance, but also during blasts. So that can be a military blast, or someone unfortunately is in a situation where there's a blast or explosion around them and they're catapulted forward or backwards. That can lead to a concussion. So what actions cause a concussion? Playing sports is honestly the most common thing that we see as a cause of a concussion. It could be, everyone thinks about concussions in football because of CTE, but it can also occur during hockey, soccer, while snowboarding. because people can, you can headbutt a soccer ball, you can fall while snowboarding, you can get into a fight while playing hockey or get hit by the hockey puck. So there are a number of different reasons why during sports someone can actually develop a concussion. Being thrown into the air is another thing, and especially because all of these sports are played on surfaces that, for the most part, are hard surfaces. And so there's a higher likelihood of getting a concussion while playing sports, either during the actual event or in practice. What other actions that can cause a concussion? Like we just mentioned, a car accident, but also a bike accident. Like we mentioned, a military blast, being hit on the head, walking in New York where there's always so much construction that's happening. A construction tool falling from a skyscraper can cause a concussion. More than likely, it would probably be more than that, but also slipping on ice, having a fight or falling down a flight of stairs those are some things that can cause a concussion in everyday experience for individuals who are not playing a sport. How does it become a concussion is a really helpful thing to know. So the brain can bang against the skull, and part of the reasons why we tend to see concussions and a lot of frontal lobe changes, which would impact attention, the development, how one learns, as well as executive functioning, because when the brain hits the skull, these grooves for your eyes can actually increase the likelihood that you're getting a concussion in the front part of your brain as opposed to other areas. So the brain banging against the skull can cause the concussion, as well as chemical changes to the brain, an imbalance of neurotransmitters. Damage to the cells. You may hear of things like tearing and shearing of axons, which would cause a diffuse axonal injury, or altered signals between cells. And all of those things can cause a concussion to occur. Common questions about causes. Can you wake up with it? No. You can have symptoms later on, but you're never going to magically wake up with a concussion unless there's a precipitating event, but you may have a delay in symptomatology. Are there obvious symptoms of physical symptoms like a cut or a bruise? You might, but you very well may not have a concussion or a cut or a bruise. Does it only occur while playing sports? Nope, as we discussed. And can it happen if someone hits their head on something? It definitely can. But if someone doesn't hit their head, yes, it definitely can if there's a sudden jolt forward or backwards. So what are some of the signs and symptoms of a concussion? Cognitively, there can be a loss of consciousness upon injury, confusion, simple things just not making sense, a person feeling dizzy, not remembering what happened. It's really not uncommon for someone to lose a couple of seconds and not actually remember being hit. It's unlikely that someone will not remember things that happened days in advance, but maybe, a couple of minutes to an hour or so before or after the event. Being slow to answer questions, feeling like your thinking speed is a little bit slower, and how that can come out is, when you're driving, not reacting to things that are happening around you, and just in general, not feeling like yourself. Physiologically, some of the signs and symptoms can be like a headache, nausea, vomiting, slurred speech, trouble sleeping. I feel like headaches, nausea, and vomiting are some of the things that people tend to automatically think about when they think about the physiological symptoms of a concussion. But someone can also have blurry vision, double vision, be a little bit wobbly in their balance when they're walking and then when they're running. And this does not just have to be in like right after the concussion happens, but it can be for a couple of days or for a couple of weeks afterwards. And emotionally, there are also and I feel like this is often the part that's forgotten about concussions. There can be an increase or development of sadness, depression, anxiety, feeling just kind of emotionally flat or foggy. But in addition to that, people can be more irritable than normal, having a short fuse, being more argumentative, fighting more verbally or physically, being emotionally dysregulated, using alcohol or substances more can be something that comes up for someone where they're more likely to drink, or it's harder for them to stop drinking. And then sometimes people have PTSD, post-traumatic stress disorder, related to the event. And that can be somewhat exacerbated by having the concussion and the difficulties around the concussion. So everyday complaints. So, I use terms like attention and memory, but everyday complaints can occur in any number of realms, whether you're at home, at work, in school, while taking care of the children, playing sports, while driving. If I'm saying that someone's attention is impacted, it basically means that it's hard for them to focus or keep track of a story when they're watching the news. They can't solve simple problems. It may be in the realm of memory. How does that play out? It's hard to remember details or things to do on their to-do list. They can't keep track of a movie or movie storyline when watching a movie. That tends to come up pretty regularly. And then also it takes longer for them to think of someone's name. So those are some examples of how memory can be impacted during a concussion. Also in the realm of executive functioning, we all, many of us, not everyone, but many of us like to do, have background noise or do one task while doing another. And it's harder to multitask. It's harder to listen to music while typing. You may burn dinner because you started doing something else and forgot that you were doing cooking. It's harder to plan out your kid's schedule and your own schedule. You may forget what you were doing because you took a really quick phone call. And then in terms of the emotional and executive functioning realm, impulse control. When someone is upset that's had a concussion, they may be more likely to blurt out what they're thinking, even if it's really mean, and even if before the concussion, they're really good about controlling those verbal or physical impulses. So learning everyday complaints can be for learning and doing schoolwork. Like a child may complain that they get tired really easily. It takes them much longer to get their work done. They're getting headaches, or their vision may be blurry by the end of the day. Lights may feel really bright. It's harder for them to learn new concepts. School feels more difficult, or work feels more difficult. And when driving, things that are automatic for us, like, looking around as we're going to merge a lane. There's an increased likelihood that one can get into a car accident because your attention is impacted and your ability to concentrate, your reaction speed is impacted. So, merging lanes may be a lot more difficult than it would have been otherwise. People may lose their keys more frequently, forget to get off at an exit, or be more distracted by kids in the background talking or playing and things like that. And then the physical symptoms, headaches may get worse throughout the day, or a headache that's hard to get rid of, feeling tired all the time, starting the day off may be fine, but they're exhausted by 10, 11 o'clock in the morning, whereas, they wouldn't get their dip downward until about maybe 2 o'clock, 3 o'clock. As I noted earlier, lights feel really bright. Their vision gets more blurry as the day progresses. And then mood-wise, emotions, people feeling like they're crying easily, jittery. The smallest things make them angry. They're having trouble falling asleep, staying asleep, or waking up in the morning when it used to be a lot easier. And noise is making them anxious. And that can be the result of noise, sensory sensitivities that may come from the concussion, or, the trauma of the event. If one remembers the event and it involved a loud noise, that can be a everyday complaint that someone experiences. So that brings us to, how soon will symptoms appear? You're really expected to experience those symptoms immediately or within minutes, maybe even hours. You're not necessarily expected to have symptoms of a concussion months later, but they can develop hours after the injury, or you may not notice them for days later because you're resting after the concussion, or you didn't have to go to school for a day or two, and then you enter a school or work environment and realize, oh, I'm kind of having trouble concentrating or following. So, it's important to note that within the couple of days of the event, it's important to just monitor one's own cognitive, physiological, or emotional experiences to see if there may have been a concussion. And, something that always comes up is, when should I be alarmed? When should I go to the emergency room, or even urgent care? And I would always say, it's if someone has been on the field, when playing sports, if there's a physician there, if someone's has a loss of consciousness, they want them to be evaluated. But sometimes when shoveling snow, you might fall and lose, consciousness for a second or two. You may not want to go to the hospital, but it's important to just get yourself checked out to make sure that there's no more serious injuries like bleeding that's occurring. So if someone loses consciousness or is knocked out, even if it's for a couple of seconds, go to the ER and check it out. If someone loses consciousness, not just in the moment, but hours or days later, that's really important to go, because it may be a more serious thing that's happening within the brain, like bleeding. If someone fainted or has a seizure, repeated vomiting, severe headaches, a headache that is getting worse over the days or hours. If there's any new sensations like tingling or numbness in one's hands or legs or fingers or toes, and any symptoms, honestly, that are concerning to you or others, just go to the ER. It's better to be safe than sorry. And so, can concussions worsen other conditions or experiences? The answer is definitely yes. If someone has a concussion and they have ADHD, which a hallmark characteristic is attentional weaknesses or difficulty with sustained attention, they're more likely to experience a heightening of those difficulties with anxiety, with attention. It may make it harder for them to read if they have dyslexia, because that ability to concentrate on sounding out a word, that if concentration is weakened, then it's going to be harder to sound out a word that was already difficult to sound out. Someone may have a worsening of their anxiety or depression. It may come from the concussion or just the trauma of an event like that happening and remembering that event. As well as uncertainty, which we'll get into later on. But eating disorders, being able to feeling more difficulty with controlling one's impulses, or feeling even a little bit more rigid, that can be exacerbated. Family conflict, if there's already arguments and someone, because of the emotional aspects of a concussion, is feeling like it's harder for them to control their verbal impulses. They may be, say meaner things or speak when they wouldn't have spoken automatically. And then therefore the arguments tend to worsen. And so family conflict is not unusual to see for someone who's had a concussion. And then in the things that we discussed earlier, someone has executive functioning weaknesses, lower processing speed, those things can get worse. But also, if someone has a history of prior concussions, they're more likely to have symptoms with each subsequent concussion, and they may also be more likely to have slightly longer symptoms with each concussion, because they've had that experience before, and it's just the brain is having a harder time recovering. And in addition to that, just daily stress. When you have a concussion, your ability, your resources, your coping skills, your attention, your memory, all of those things are taxed. So daily stress can just feel even more significant, because you just have less resources cognitively and emotionally to deal with that. And then in addition to that, age. One of the pre-questions was, how does age impact? And one thing that we know, age is not a determinant of someone's symptomatology, but as we know with other conditions like anxiety and depression, kids don't always have the language to tell you how they're feeling emotionally or cognitively or physiologically, like maybe they're a little bit more restless. They don't usually have those words. So they may have more symptoms than they're able to express because of their language skills or self-knowledge. But in general, it's not expected to impact kids in a different way than it would adults. But adults may just, or teenagers may give you more symptoms than a child would because of language. In addition to that, recovery is not expected to be any different for children as it is for adults. However, the recovery process can be a little bit slower for much older adults because of just brain matter decreasing over time with much older adults. Let's see. So, and COVID-19, identifying that, it's important to think about COVID-19 in this context of concussions. The fact that, as I noted just now, stress can, be exacerbated by having a concussion, but the uncertainty around COVID-19, the new variants that are coming about, that already built-in stress that we're going through can be exacerbated by or worsened by a concussion, but also the financial and work changes that are associated with COVID-19 in our daily lives, family dynamics like being around family members more often or being separated from family members because of any number of reasons. Those things that are associated with COVID-19, not the actual being infected by it necessarily, but just the experience of us collectively can impact one's reaction as it relates to having a concussion during COVID-19. But other factors so as I just noted with COVID-19, uncertainty can really make an impact on how one reacts to concussion symptoms. But in addition to that, losing control over one's health, the stress of that, of losing control, not knowing what to expect, or the expectations not matching with what one would hope can really add stress and prolong, the length of time that one is experiencing those symptoms. Frustration or intolerance of deficits, if you feel like I should be strong, I shouldn't have these deficits, I just hit my head, but not realizing it's a traumatic brain injury, and of course you should have a reaction. All of those things can play a role in how one experiences a concussion and their reaction to those symptoms and the recovery process. And previous coping strategies. It's important to note that, if you're someone who is accustomed to dealing with things head on, accepting things as they are, but pushing through, that makes the concussion recovery process a little bit easier sometimes than if someone has more of a rigid stance about, never being sick and never being impacted by anything. It can really play a role in the experience of the symptoms as well as the recovery process. Okay, so the role of symptoms on recovery, severity is important to note. So severity can play a longer role. If you had loss of consciousness, you definitely may have a longer experience for symptomatology. That could be, and one thing I will say with concussions, most people, it's resolved within a couple of weeks, a lot of people a couple of days, but some people are what we call long haulers. And they may have a post-concussion syndrome where it just lasts a few months. And, but in general, because it's a mild traumatic brain injury, someone is expected to have a recovery process, but the more severe the injury, if there's loss of consciousness, the more likely it is that the person will, have longer symptoms. And we already discussed age as it relates to symptoms and recovery. So that brings us to, how is a concussion diagnosed? You always have to have a specific physical event, whether it's a fall or, being tackled on the football court, something happened. Then you also have presence of symptoms. We just went through cognitive symptoms, physiological symptoms. For cognitive, attention and memory, physiological would be changes in vision, changes in balance, headaches, nausea, vomiting, and then also emotional symptoms, increased irritability, sadness, anxiety, things like that can be some of the things that a clinician like myself or a medical doctor would look for to diagnose it. So sometimes it's done with a brief cognitive assessment at the site of the injury for when people are playing sports, a lot of times there's a physician right in, on the sidelines waiting to assess someone to see if they've had an injury, if there's any difficulties with speech patterns, they look dazed, things like that. But at other times, and in those moments, and even afterwards, you'll look for an assessments in balance or coordination and reflexes. That could be done by a medical doctor or occupational therapist or physical therapist or athletic trainer. And then for us as neuropsychologists, we tend to do more extensive cognitive assessments in the weeks or months afterwards if someone wants documentation that they've had a concussion, and if they want to see, how severe those deficits are, or, do I really have the deficits that I think that I have, and how severe are they? Let's see. Just a second. Okay, so let me see if I can go back. Okay, so concussion treatments, concussions and neuropsychological assessments. Recognizing it's really important as we do neuropsychological assessments to diagnose a concussion, to take information, all the information in. So we want to recognize what those symptoms are that a person showed, but also recognize how family dynamics, cognitive, psychological, and social histories may also be playing a role in the expression of one's symptoms. We'll ask a lot of questions about not just the symptoms, but how is it affecting one's daily life and current experiences, identify triggers to worsening symptoms like when arguments with family members or in school, as the day progresses, or when one has to go to the gym and the lights are bright and the noises are louder, are there certain triggers that lead to worsening of the concussion related symptoms? And we also incorporate information from collaterals like parents, spouses, kids, therapists, athletic trainers, and physicians. Hearing what the person has reported to them is always really helpful. When I worked at NYU, I would just look at someone's notes to see if they were reporting symptoms that to their therapist or physician that I was, hearing. But also we'll call them up and see what other people have noticed about them. Okay. Sorry about that. And then, it's always important for us, especially as neuropsychologists, you don't want someone to just hand you a piece of paper and say, okay, you do or you don't have, you did or you didn't have a concussion, or you do or you don't have post-concussion syndrome. And, you want to have a discussion of what, the findings are, get information and education about what a concussion is, how long symptoms are expected to last, and if there's no evidence of a concussion, all right, let's talk about why you may be experiencing anxiety or depression and link you to treatment. And let's talk about the recommendations. So regardless of what the outcome of the neuropsychological assessment or concussion assessment is, we're always going to set you up with information and education, but also discuss, all right, these are my recommendations. This is why I'm giving you these recommendations so that you can feel better over time, whether it's cognitive remediation or psychotherapy or medication management, any number of recommendations we can make. And we're going to get into that conversation about what cognitive remediation is. It's meant to be, it's like cognitive training, essentially. It's meant to be short-term. It's not meant to be for years and years and years, but people will do cognitive remediation for a couple of months. Usually it's time limited, and it focuses on attention, planning, organization, like identifying routines and strategies to help with countering those attentional difficulties or executive functioning difficulties that were temporarily weakened by the concussion, help someone with being concise. Sometimes that impulse control can lead to people being very verbose and kind of pulling them back. Identifying communication scripts can sometimes also be really important, because the less you have to rely on coming up with an answer or a response in a moment, if you have a little bit of a script, that can be really helpful in taking off the pressure and the anxiety of moments that, sometimes are stressful or repeated in some ways. Cognitive remediation can also identify emotion regulation strategies to help with decreasing anger and impulsivity, as well as identifying ways to improve impulse control. As it relates to the other options, sometimes when it comes to neuropsychologists, it's not just cognitive remediation, but also psychotherapy. Cognitive behavioral therapy is really helpful because it gives someone information about what a concussion is, how they're doing, and how they're expected to do over time. But it can also identify negative and inaccurate thoughts that may be contributing to prolonged symptoms. But it also may reinforce positive thoughts like, no, I am getting better. It's so nice to see that you are getting better. These things take time. Positive reinforcement is always really helpful. Building self-confidence through feedback from peers or psychotherapy. A lot of times there are concussion groups where someone can discuss their experiences of having a concussion with other individuals, but also can be in individual therapy for a couple of weeks or a couple of months as you kind of get over the symptoms. Sometimes it's nice to have an additional support system outside of family and friends. And then cognitive behavioral therapy can also help identify behavioral health routines that, meditation, creating a schedule and a plan, all of those things, those behaviors that we do to take off stress and make our lives easier can be really helpful in reducing emotions associated with a concussion, like anxiety or depression, or even irritability. And so, it's important, as I just noted, to also look at the behavioral activation, relaxation and stress reduction, but also sleep and nutrition and exercise are all really important. I think, originally people thought once someone has a concussion, don't sit in a dark room, don't do anything for weeks on end. And we know more and more now that, increasing activity little by little is important. We don't want you running a marathon 2 days after having a concussion, but taking a walk is actually really good for physical and mental health and the development of the brain cells that have been damaged. The more oxygen, more blood flow that we have to the brain, it helps with the cell recovery because that blood is bringing in oxygen and nutrients to rebuild our brain. Getting adequate sleep is so incredibly important, and psychotherapy can help with that and talking to us about relaxation techniques, and also just the education about the value of sleep is so important. And nutrition, it's just really important to have a balanced diet and things that can fuel recovery. Fruits and vegetables are always way better than junk food. So and then aside from that, aside from what your neuropsychologist or psychologist can provide to you for concussion treatment, whether it's neuropsych assessment or cognitive remediation or psychotherapy in the form of cognitive behavioral therapy. But in addition to that, occupational therapy, they can help with balance issues, movement, but sometimes they can also help with brain training to improve on attention and memory and executive functioning. Psychopharmacology can also be something that's helpful for, let's say, medication to help with anxiety or depression, even if it's temporary. Also, medication for sleep can also be helpful. So working with closely, us as neuropsychologists, we tend to work really closely with occupational therapists, medical doctors, physical therapists, speech therapists, and athletic trainers to really optimize the recovery process so that people are not feeling like they're alone or isolated in the process. And sometimes people wonder, are there a maximum number of concussions? When is it too much? Especially in light of chronic traumatic encephalopathy, better known as CTE, something we often have heard a lot about in the news. Something that we note is there's not one size fits all. There's no clear-cut rule, but we do know that athletes with 3 or more concussions are definitely more likely to have cognitive impairments and emotional struggles, short-term and sometimes long-term. And that long-term relates to more the realm of CTE, where it can the more concussions one has, the more likely they are to develop CTE. So it's just, as healthy as you can be, as careful as you can be, the better. And as you know, and we'll get to that about ways to prevent it, but getting back to regular life, it's always really, really important to return to school or work. It's not a good idea to stay in a room, like I said, sit in the dark for 3 weeks until you feel 100% better. It's important to step out and see, all right, what are my symptoms really? And sometimes the only way you're going to know that is by going to school or work, and then progressing from light, then moderate to heavy activity to increase blood flow. So that would include walking or taking walks, then maybe a jog, and then eventually, running for, an hour. But it's always important to increase it little by little over the span of a couple of weeks. We always recommend avoiding sports for a few days to a month. And in addition to that, symptoms should fully resolve within a few days, but possibly up to 3 months or more. So, the latter is a little bit less likely, but it's more likely to occur with more symptoms, more concussions, I mean, or more severity in symptoms. So something that always stands out to people is, how do I avoid this? How do I avoid a concussion in everyday life? And it's really important for kids to always put kids in age and size appropriate car and booster seats, because that will really help limit the impact to their head and to their brain if there's any car accident that happens while their parents or someone else is driving. Also, having stair gates at the top and bottom of stairs is really important, especially if you have younger kids, because you don't want them taking a tumble downward. Walking up the stairs with kids is always really important. Walking behind them just in case they fall, but you also have to make sure you don't fall also. And then also, in addition to that, if you're playing sports, playing on soft surfaces like sand and mulch, playing on grass or dirt is going to increase the likelihood that someone will develop a concussion from that fall. Also, wearing a helmet is always really important, not just for concussions, but also some of the traumatic brain injuries that we mentioned earlier, like a contusion, or one where the skull is being pierced. So it's just really important to wear helmets whenever possible. You can still have the second criteria for a concussion, which is that shearing and tearing, where someone's head is thrust forward and backwards. Even if they're not hitting anything, that still can occur. If playing football, you're tackled, even if your head doesn't hit the ground, but it's helpful to wear a helmet. And then limit tackling during they don't tend to limit tackling during games, but they do tend to limit tackling during practices for football. So that's also really important to note, that in getting concussions, it's not just on game day. A lot of people actually get concussions during practice and exercise runs. So it's important to limit tackling, limit heading of the ball, try to avoid fighting in different sports, and then stop playing as soon as there are symptoms, and don't go back to playing until being cleared by your medical doctor or clinician. And so that is it for me today. But if you're looking for more support or are interested in a concussion assessment or a neuropsychological assessment as it relates to whether or not you've had a concussion, or any number of concerns, whether it be attention or memory or executive functioning, or learning, please feel free to reach out to us. We're really happy to help and answer any questions as you may have during the process of deciding whether or not to do a concussion assessment or a neuropsychological assessment. And thank you so much. I really appreciate your time. And so,
thanks, Natasha. That was awesome. That was so much information. Like, that's a lot of slides, but you got it done. It was very impressive.
Thank you.
To those of you who are listening, if you have any questions from what Natashia said or things that you are still wondering about, please send them to me in the Q&A box. I do have a question here that says, my 8-year-old got a really bad concussion a couple of months ago. She was in an accident and she was knocked out for about 20 to 30 seconds. And so they have a couple of questions. Is the amount of time that you're unconscious correlated to the recovery? So are some concussions worse than others? Are you more likely to recover more quickly if you're only unconscious for a couple of seconds versus 30 seconds versus longer? What do you think about that? And then I'll get to the other question.
Yeah, no, that's a great question. So there's no one size fits all, but the general rule of thumb is if you've lost consciousness and the length of time that you've had loss of consciousness, it increases the likelihood that you'll have more symptoms, and it may take longer for those symptoms to subside.
Okay. And then they also want to know, how do you know if moodiness 2 months later is because of the accident or just normal developmental stuff for an 8-year-old?
So I would link back, that's a great question too. I would link back to what were some of the symptoms that you noticed early on? Did you, within a couple of days, did you notice irritability? Or are you just seeing it now, month and a half, 2 months later? Because if it came immediately thereafter, then it's probably related to the concussion. If it didn't come until a month and a half or 2 months later, it's likely related to external factors or normal developments and chemical changes in one's body.
Yeah, that makes sense. So, one of the questions that I have, you touched on it a couple of times, but earlier on when we were growing up and stuff, the recommendation for a concussion was always, like you said, go in a dark room, don't do anything for days on end, and that we've been finding in the research that is more likely to actually prolong someone's sick role, that they see themselves as sick more, and it actually contributes to more brain fogginess and memory issues and a lack of motivation, sometimes depression, than is actually attributed to the concussion itself. So can you talk a little bit more about how that has changed over time and what the best practices are right now, and especially for avoiding that that I'm sick, I am, sort of creating or at least contributing to some of my difficulties by my mood and my expectations?
Yeah, absolutely. That's a great question. So, one thing I will say just to start off with, when we're sick and we're not feeling well, the last thing we want to do is get up and walk around, right? When you feel sick and you don't feel like yourself, the instinct within all of us and our family members and people around us is for us to just sit back and relax. And what we know now is, as time has progressed, the importance of everyday movement and oxygen, blood flow, and therefore oxygen and nutrients getting to the brain. So that is a major reason why sitting and not moving actually is counterproductive, because the more you're moving, the more likely you're therefore you're having increased blood flow and oxygen to the brain. So it actually helps stimulate the process, movement, because you're just having better blood flow. And so we only know that because of the research, and it's also impacting not just the concussion research, but also how to ward off dementia. Yeah.
I don't know if you saw it, actually. I just saw an article recently, maybe it was just released this week, that said that even light to moderate exercise is now recommended for in the days after concussion for the same reason.
Right.
Yeah.
No, very true. It makes a huge difference.
So how about that whole idea of just avoiding the sick role? Any thoughts on that?
Yeah, that's another really good point. So avoiding the sick role, that can lead to an exacerbation of symptoms. Seeing yourself as sicker than maybe one is can lead to one staying in that role longer periods of time, assuming that they have a post-concussion syndrome when maybe they don't. So it's really important to, in moderation, slowly increase one's investment, because perception is really important, and perception that, you don't want to be on either extreme. You don't want to think that everything is terrible because you've had a mild traumatic brain injury, but you also don't want to think that everything is okay and I can get back to playing, even though I've had a concussion. I'll just will my way through it. So it's better to kind of be a little bit more in the middle.
So if you have a child or an adult that is feeling moody and irritable, a month and a half, 2 months later, and maybe is seeing themselves as, oh, but I had that concussion, so it's not my fault that I'm feeling moody. Like, what do you think is a more productive way of handling that reaction, those symptoms?
I think the investigative part would be really helpful. I think, let's talk about, how were you feeling? As your parent, I didn't notice that you were that irritable until recently. So it's probably not related. It's probably other things. Let's talk about what's going on in school or how our relationship is. I think it's important to really have those really broad conversations to try to get at the heart of the matter, because the truth and the educational aspect of it is, if it's not showing up within the first couple minutes or couple of days, and sometimes that couple of days is a function of, whether or not you've gone to school or work and then say, oh, I'm a little foggy. I didn't realize I was kind of foggy when I was at home.
Yeah.
So that's really important. So
Cool.
education and a broad conversation.
Investigation.
Yeah.
Makes sense. How about that symptom of loss of consciousness? How important is that to whether or not someone truly has a concussion?
It's important in the sense that if when a concussion happens, we do those on-site evaluations. So you might have something called the Glasgow Coma Scale, just to see where someone scored on that. And the higher the score, the higher the or more significant the brain injury is. So, it's repeat the question again. I'm sorry.
Well, I'm just wondering, I understand. I'm just wondering whether, can someone, are losses of consciousness always associated with concussion? Can you have a concussion without having had a loss of consciousness?
Oh, great question. Yes, you definitely can. You do not need a loss of consciousness or seeing stars or forgetting what happened in the moment in order to be diagnosed with a concussion.
But I assume there's always some just general either dizziness or disorientation or confusion. I mean,
Yeah.
are any of those listen, it's not a concussion unless you have one of these symptoms?
No.
Is it something like that?
There's no one size fits all, but you are expected to have symptoms in one of the three categories: physiological, cognitive, or emotional changes.
Oh,
But
so
the
someone might
emotional change
have,
is a little tricky because it
right.
could be external experiences that have nothing to do with, being hit in the head.
Yeah, that's really hard, especially when there's no physiological test. It's all, like you said, based on clinical observation, right? So if someone has a concussion and they came in and all they have is emotional problems, that's going to be a really hard call to make, I think.
Yes, very, very true. Unless they are saying that they're irritable and getting into fist fights when they never were getting into fist fights before.
Yeah, that makes
That
sense.
adds a little bit more credence to it.
Yeah, sure.
But then there could be substance abuse. There could be, external factors. So, but yeah, it does make it harder if it's just emotion.
That's why a thorough and multi-method neuropsychological evaluation is so critical.
I 100% agree.
So, of course, concussion and CTE always comes up when we're talking about sports. I know you mentioned that with football and soccer. I think a lot of our population, the parents with kids who play soccer, and so one of the big questions is always should I not allow my child to play soccer because because of heading the ball? Do you have an opinion? Do you want to weigh in on this debate?
Two things. So the research says that it's the more concussions you have, the worse it is for you. So if someone has one or two concussions, it's probably better to see if you can find something else that brings joy.
That's a great way of putting it.
In the nicest way. I said that in the nicest way. But I also think it's really important, if a child has a passion for football, to let them play football. And if you start to see, if there are things that are happening, and a concussion occurs, then let's talk about, not just the moment, but let's talk about how that can impact you lifelong. And over time in school and the profession you choose, how you interact with your friends and your partners, things like that. I think it's really important to have those conversations.
Just continual monitoring and
absolutely.
reassessment.
Absolutely.
Okay. And then how about this idea of ourselves? So, adults tend to be like, oh, I'm fine, it'll be fine. I don't feel like going to the hospital, that sort of stuff. Like, do you have I know nothing is going to be hard and fast, but do you have any clear idea that you can tell people, like, if you have hit your head and you were experiencing X, you should go to the ER now?
Loss of consciousness is not normal. So I would say loss of consciousness is probably the only hard and fast rule. But I would also say I would go to the ER and have a CT scan just to make sure it's not more serious than a
Yeah,
concussion.
sure. No,
If
that
you
makes
have
sense.
tingling or numbing, seizures, hard and fast. So seizures, loss of consciousness, close second is tingling and numbing of any extremities, and yeah, headaches, especially if they're getting worse.
Mm-hmm. Okay.
Nausea, vomiting more than a little bit more than nausea, but vomiting not normal either. So
But like like vomiting once in the hour or two after you hit your head, that's kind of common, right? I think I've heard that.
yeah,
But
it's
then
not
more
uncommon.
than that, okay.
Yeah,
And
more than
say
that,
you,
but even if you have, it just
okay.
I'd rather be safe than sorry, right?
Yeah, sure. No, it makes sense. And then say you do go to the ER.
Mhm.
Is there really anything that they can do for you besides say, yep, it's a concussion, go home, don't lock yourself in a dark room for the next 5 days and take it easy? Like what are they going to do to help?
So depending on where you go, they may give you a treatment plan, which might be based on NIH or NIMH, where they would say, okay, this is how you slowly re-enter physical activity from low to moderate to
Oh, that's
heavy
great.
activity.
Yeah.
And then they may also refer you to a neuropsychologist if they're in the system, or to another physician, usually a physiatrist, to monitor you on the outside, especially, and usually it's to a physiatrist if there's any balance changes, walking changes, blurry vision, or they might refer you to an OT for blurry vision or other visual changes. So, it can vary depending on which ER you go to.
All right. So what's the best ER, Natasha?
Teaching hospitals, NYU for sure,
Of course.
because they have a
Go to
concussion
Rusk.
unit. Yes, go to
Yeah.
Russ for sure,
Yeah.
for sure.
Awesome. All right. Well, thank you so much. Thank you for sharing everything that you know. Thanks to those of you who are watching. It was really awesome to have you here. I'm just like going to put in our last plug again for our next webinar, which is going to be on January 12th, where I am going to be talking about how to explain and talk to kids about psychological diagnoses. I will be posting information about registration on that a little later today or tomorrow. I will also be sending a recording to those of you who registered, and please feel free to reach out if there's anything that we can do to help you. Thanks as always to Park Slope parents for helping to get the word out about our series, and have a great rest of your Wednesday, and we'll see you next month. Bye-bye.
Bye. Have a good one, everyone.